Good news. Colon cancer is curable and treatable if caught in early stages. Bad news, about 150,000 new cases of colon cancer are diagnosed each year in the United States, making it the second most common type of cancer and the second leading cause of cancer death in the United States. About 5 years ago, my grandmother was diagnosed with colon cancer. She was lucky and had to only have a small portion of her large intestine removed and had no radiation or chemotherapy. It seemed to be gone. Then the following year, my aunt was diagnosed with this. They found a bunch of polyps and had them removed. She had to undergo chemotherapy and radiation, and to this day, she has to go and have annual checkups. And this leads me to my research on colon cancer. Colon cancer is uncontrolled growth of the cells that line the inside of the colon or rectum. The body is made up of different types of cells that normally divide and multiply in an orderly way. These new cells replace old cells, and this process of cell birth occurs constantly in the body. And cancer growth occurs when some cells in the body begin to multiply in an uncontrolled manner. The body's natural defenses, such as certain types of the immune system, cannot stop uncontrolled cell division. The abnormal cells become greater and greater, and in some types of cancer, the uncontrolled cell growth forms a tumor. There are two types of growth that occur in the colon: the non-cancerous, such as the polyps, and the malignant, which is the cancerous growth. If a polyp is developed and is not removed, it may become cancerous. Once cancer develops, it begins to invade the intestinal wall and may spread to nearby lymph nodes. The biggest factor of colon cancer is age. Most colon cancer is diagnosed in those over 60. As I had mentioned earlier, my grandmother was diagnosed with it, and when she was diagnosed, she was actually in her 40s. My aunt was in her late 50s, I believe. There are known genetic and environmental factors, and when more than one family member has had colon cancer, the risk of the other members may be 3 to 4 times higher for developing it. Some symptoms of colon cancer can be confused with a number of digestive disorders. The symptoms that mainly go along with colon cancer are bleeding from the rectum, changes in bowel movements, a feeling that a bowel movement cannot be completed, and unexplained weight loss. The best way to diagnose colon cancer, if you have any of these symptoms above, you need to make an appointment with your family physician. He will go over your family history, run some tests, and if needed, there is a specialized screening test called a sigmoidoscopy. And this is when they take a flexible tube, insert it in the anus and rectum, and go through the lower part of the colon. The doctors will examine the walls to determine if disease is present. If doctors see an area of tissue that looks unusual, they remove a small sample and send it out for analysis. This test may detect 50% of colon tumors and nearly 100% of rectal. For people that have colon cancer, the outlook for people with colon cancer has improved steadily in recent years. Surgery, chemotherapy, and radiation are 3 types of treatment available. When detected early, surgery alone is the only treatment necessary, and cure rates are excellent. Sometimes, when cancer is surgically removed, radiation therapy or chemotherapy may reduce the risk of cancer spread. The best way to prevent cancer is to schedule regular screening tests, avoid diets high in fiber, high in fat, alcohol, calorie, and red meat, and eat foods rich in fiber. A few other steps towards prevention are to quit smoking, drink alcohol in moderation, and lead an active lifestyle. After having done all of this research, it is my belief that early detection is crucial to the prevention of colon cancer. As this has laid out the cause, symptoms, treatment, and prevention, we can walk away from this knowing that colon cancer is not a death sentence. According to an article I read in the Orlando Sentinel, it states that hormone therapy might be a good idea for women who are concerned about colon cancer. Most of the research that I got from this article was from the eHealth MD on the internet. And having spoke to my grandma and my aunt about what they went through, their symptoms, what led them to go to the doctor, my grandmother to this day is doing very well, and my aunt has to go back very often in order to find if she has cancer.